गुड आफ्टरनून फ्रेंड्स, स्टूडेंट्स, कैसे हो बच्चे लोग। तो आज एनएमसी चेयरमैन डॉक्टर सुरेश शर्मा ने आकर के अनाउंसमेंट किया है, he's taken a live webinar for all the final prof MBBS students and he addressed them across the country। और बहुत सारी चीज़ें, बहुत सारी क्वेरीज आपकी जो नेक्स्ट एग्ज़ाम, अपकमिंग नेक्स्ट एग्ज़ाम को लेकर के थे, उसको क्लियर किया है। उनके फर्दर क्लेरिफिकेशन के लिए आई एम हियर ऑन दिस चैनल, आई एम डॉक्टर सरवजीत, योर वेरी ओन ENT फैकल्टी एट द LNX प्लेटफॉर्म, और मैं आप सबकी क्वेरीज को लेकर के आया हूँ। आई होप यू आर ऑल एबल टू लिसन टू मी। कैन आई हैव ए थम्स अप? ओके, कैन यू ऑल हियर मी? राइट। सो बहुत सारी क्वेरीज हैं। फर्स्ट ऑफ ऑल, पहले ओपनिंग स्टेटमेंट में ही NMC चेयरमैन सर ने सबसे पहली चीज़ जो बोली है वो ये है कि नेक्स्ट इज़ कन्फर्म्ड। इस साल से फाइनल ईयर के यानी कि 2019 बैच के जो बच्चे हैं उनके लिए नेक्स्ट अब आ रहा है, नेक्स्ट इज़ कन्फर्म्ड। ओके, और ओपनिंग स्टेटमेंट थी कि इट विल बी ए कॉम्प्रिहेंसिव कंप्यूटर बेस्ड एग्जामिनेशन, जिसमें कि हाई क्वालिटी मल्टीपल चॉइस क्वेश्चंस मिलेंगे आपको। राइट, तो ये उन्होंने बहुत अच्छी बात बोली कि ये नेशन वाइड होगा पूरा पेपर, जैसे कि आपका नीट PG पेपर होता है वैसे ही अब होगा। एंड नाउ दिस इज गोइंग टू रिप्लेस योर फाइनल प्रॉफ एग्जाम्स। राइट, तो ये एक हमारा बहुत वो है। और क्या बोला उन्होंने, और ये बोला है कि जो हमारे MCQ क्वेश्चंस हैं दे विल एड्रेस जो नॉलेज हैं, कॉम्पिटेंसीज हैं, हायर नॉलेज, क्लिनिकल नॉलेज को एड्रेस करेंगे क्वेश्चंस को। राइट, तो कि ताकि हमारी जो मॉडर्न सिस्टम ऑफ मेडिसिन है उसको हम इंडिया में अच्छे से प्रमोट कर सकें। सो दैट विल बी द ऑब्जेक्टिव ऑफ द नेक्स्ट स्टेप 1 एग्जाम। राइट, सो जिस किसी के भी मन में डाउट था, शंका थी कि नेक्स्ट होगा नहीं होगा, कैसे होगा, तो पहली बात तो सर ने ये स्टेटमेंट बोलते ही ओपनिंग स्टेटमेंट में ही क्लियर कर दिया कि नेक्स्ट कंफर्म्ड है। राइट, ओके। और इसमें जैसे डिस्ट्रीब्यूशन ऑफ आइटम्स है, तो हमारे को पता है कि एक हमारे पास ड्राफ्ट डॉक्यूमेंट आया था NMC का, जो कि दिसंबर में आ चुका है हमारे पास, दिसंबर 22 में, और उस पर मैंने पहले भी एक अपनी टॉक दी थी एंड आई टोल्ड यू कि नेक्स्ट के एग्ज़ाम कैसा होगा। सो मोस्टली वो सारा कुछ ऑलमोस्ट सेम है। एग्ज़ाम का पैटर्न जो स्टेप 1 का पैटर्न है दैट इज़ एग्जैक्टली सेम, लेकिन उसमें साफ साफ बोला है कि जो भी ये नेक्स्ट 1 का एग्ज़ाम होगा इससे रट्टाफिकेशन, यानी कि जो रोट होता है ना कि आप सीनियर से जूनियर आप जो MCQs PYQs ले लेते हैं और उसको रट लेते हैं और उसी से ही चल रहा है काम, तो वो नहीं होगा। बेसिक रीडिंग पे, बेसिक लर्निंग पे, क्लिनिकल स्किल्स पे, आपके वार्ड के पोस्टिंग्स पे, उन पे स्ट्रेस होगा। तो क्वेश्चंस जो आएंगे वो क्लिनिकल आएंगे, वो केस सिनेरियो बेस्ड क्वेश्चंस होंगे, वो केस विनियट्स होंगे, वो क्लिनिकल केसेस होंगे। तो आपको क्लिनिकल पोस्टिंग्स पे भी बहुत ज़रूरी जाना है, क्योंकि उनका ये मानना है कि आजकल बच्चे जो हैं वो सिर्फ थ्योरी पढ़ रहे हैं और शायद क्लिनिकल केस सिनेरियोज उतना नहीं देख रहे हैं। तो अच्छा डॉक्टर बनने के लिए आपको क्लिनिकल केस सिनेरियोज बहुत इंपॉर्टेंट है देखने, और इसके लिए ये एग्ज़ाम होगा। सो 2019 बैच से, यानी कि अब जो एग्ज़ाम आ रहा है आप लोगों का नवंबर, दिसंबर, जनवरी, फरवरी में जब भी यूनिवर्सिटी एग्ज़ाम था उसके हिसाब से ये एग्ज़ाम होगा। राइट, सो नेक्स्ट 1 में सबसे पहले हम बात कर लेते हैं कि क्वेश्चन किस टाइप के आएंगे। राइट, तो क्वेश्चन आएंगे तो आप ये देखेंगे, उन्होंने कहा था कि MCQ पैटर्न में जो क्वेश्चन होंगे वो प्रॉब्लम सॉल्विंग एंड एनालिटिकल क्वेश्चन 60 to 70% क्वेश्चन होंगे, कॉम्प्रीहेंशन टाइप क्वेश्चन होंगे वो 30% होंगे, एंड रिकॉल, सिर्फ जो रिकॉल है वो 5 to 15%, यानी एवरेज 10% के आसपास ही आपका रिकॉल होगा। राइट, तो ये बहुत इंपॉर्टेंट है कि उन्होंने बोला है कि आपके जो क्वेश्चंस हैं वो क्वेश्चंस बेसिकली दे आर ट्राइंग टू फोकस ऑन योर कॉम्प्रिहेंसिव लर्निंग एंड अंडरस्टैंडिंग ऑफ द कॉन्सेप्ट्स। राइट, और उसमें भी जो चीज़ें मस्ट टू नो है, सो those must to know are 60% and nice to know things are 30%। जो रेयर चीज़ें हैं जो आपको शायद पता हो शायद नहीं पता हो वो सिर्फ 10% रखी हैं। सो ये चीज़ हमने ड्राफ्ट डॉक्यूमेंट में भी देखी थी, दिस इज एग्जैक्टली सेम, इसके अंदर कोई खास चेंज नहीं है। अगेन जो पेपर हैं, पेपर का वेटेज इट विल बी 6 सब्जेक्ट्स, 6 पेपर्स होंगे आपके, मेडिसिन एंड अलाइड सब्जेक्ट्स, सर्जरी एंड अलाइड सब्जेक्ट्स, ऑब्स्टेटिक्स एंड गायनेकोलॉजी, पीडियाट्रिक्स, ईएनटी जिसको ऑटोरैनिटोरिंगोलॉजी भी बोलते हैं, एंड ऑफ्थल्मोलॉजी। सो ये 6 पेपर्स होंगे आपके, डिफरेंट पेपर्स, और इन्हीं के अंदर ही आपका फोरेंसिक मेडिसिन एंड टॉक्सिकोलॉजी होगा, एंड 10% क्वेश्चन बेसिक साइंसेज यानी कि प्री क्लिनिकल और प्लानर क्लिनिकल से भी आएंगे इन ऑल ऑफ दीज रिस्पेक्टिव सब्जेक्ट्स। सो दिस इज द सेम जो ड्राफ्ट में आया था, दिस इज ऑल्सो फाइनल, इसमें कुछ भी चेंज नहीं है। इनफैक्ट जो पैटर्न ऑफ एग्जामिनेशन होगा दैट इट विल बी ए 5 days एग्जामिनेशन, राइट। जो शेड्यूल है 5 days एग्जामिनेशन होगा, जिसमें 2 दिन रेस्ट डेज होंगे, राइट। तो फर्स्ट डे को मेडिसिन एंड लाइट सब्जेक्ट 3 hours का पेपर होगा, it will have 120 questions, then there will be a 2 hours break, and afterwards there will be a pediatrics paper of 60 questions and 1.5 hours, right. Same second day rest hoga, third day surgery and allied subjects 3 hours paper, 120 questions, 2 hours break, and then ENT 1.5 hours, 60 questions, and then third day obstetrics and gynecology 3 hours paper, 120 questions, followed by 2 hours break, and then ophthalmology 1.5 hours, 60 questions. So this beta is exactly same like the next draft, the final draft which was there in the December. This is exactly same, right. इसमें चेंज नहीं है, लेकिन चेंज, सबसे इंपॉर्टेंट चेंज कहाँ बोला सर ने? सबसे इंपॉर्टेंट चेंज बोला कि पहले हमारा एक मेन एग्जाम था, नेक्स्ट वन एग्जाम, और उसके 6 months बाद में था सप्लीमेंट्री एग्जाम। तो अब ये वर्ड सप्लीमेंट्री हटा दिया गया है। उन्होंने बोला कोई भी एग्जाम आप पास करो, चाहे मेन हो चाहे सप्लीमेंट्री हो, यू शुड बी ट्रीटेड इक्वल। तो वर्ड सप्लीमेंट्री हैज बीन रिमूव्ड, एंड दैट मीन्स वी विल हैव 2 मेन नेक्स्ट एग्जाम्स। हर साल 2 मेन नेक्स्ट स्टेप 1 एग्जाम होंगे, नेक्स्ट 1 के दोनों एग्जाम मेन होंगे। ये बहुत बहुत इंपॉर्टेंट चीज है, जिसको सर ने भी स्ट्रेस किया था, बहुत स्पेसिफाई किया था, और मैं भी इस पर स्ट्रेस कर रहा हूं, ताकि आप दोनों में से कोई सा भी पेपर पास करें, एनी ऑफ दीज 2 पेपर यू हैव पासिंग, यू विल बी कंसिडर्ड इक्वल, राइट। तो हो सकता है कुछ पेपर्स आप एक पेपर में पास नहीं कर पाए, तो आप सेकेंड टाइम अगर उसको पास करते हैं तो यू विल बी कंसिडर्ड इक्वल, राइट। यहाँ पे एक क्वेरी ये भी थी कि 2019 बैच में बहुत बच्चे ऐसे हैं, इनफैक्ट ऑलमोस्ट सारे बच्चे ऐसे हैं, जिन्होंने फाइनल प्रॉफ पार्ट 1 के अंदर ईएनटी एंड ऑफ्थल्मोलॉजी का पेपर क्लियर कर लिया है, राइट। सो वो बच्चों को क्या ईएनटी ऑफ्था दोबारा देना है। सो यू हैव टू रिमेंबर वन थिंग कि आपको इसी पेपर से आपका फाइनल प्रॉफ भी पास होगा, और इन्हीं 6 सब्जेक्ट्स की मार्किंग के हिसाब से आपको नीट पीजी में रैंकिंग भी मिलेगी। तो नीट पीजी रैंकिंग के लिए 6 के 6 पेपर जो हैं आपके क्लियर होने चाहिए। सभी 6 पेपर्स में मिनिमम 50% मार्क्स लाना ज़रूरी है, राइट। बट जिन लोगों ने ईएनटी एंड ऑफ्थल्मोलॉजी फाइनल प्रॉफ पार्ट 1 में क्लियर कर लिया है, तो उनके लिए ऑप्शन रहेगा वेदर इन द अपकमिंग एग्जाम, जो कि शायद नवंबर में होगा, आप राइट। सो आई एम गोइंग टू टॉक अबाउट द शेड्यूल ऑफ द एग्जाम एज वेल। लेकिन जो नवंबर में एग्जाम होगा, तो उसमें यू कैन चूज द 4 पेपर्स, दैट इज मेडिसिन, सर्जरी, obstetrics and gynecology and pediatrics, and you can choose to give ENT and ophthalmology 6 months later. But you have to clear all the 6 papers in one cycle. One cycle मतलब 1 साल के अंदर, so that you can be considered for the NEET PG ranking, the PG ranking in the next year you can get a PG seat, right? तो आपको 6 के 6 papers clear करने हैं. There he said it will be better for you that आप ENT एंड ऑफ्थल्मोलॉजी भी इसी 4 पेपर के साथ में दे करके क्लियर करें उनको, राइट। बट यू हैव द ऑप्शन ऑफ गिविंग दीज 2 पेपर्स लेटर ऑल्सो, क्योंकि दोनों ही पेपर अब जो हैं वो मेन एग्जाम हो गए हैं, कोई भी सप्लीमेंट्री एग्जाम नहीं है, और दोनों का रिजल्ट लेकर के हम उससे पीजी रैंकिंग निकालेंगे। सेकेंडली, एक क्लॉज था कि 2 साल का गैप होगा, मतलब अगर आपने एक बार स्टेप 1 क्लियर कर लिया तो उसके बाद आप नेक्स्ट ईयर स्टेप 2 देखेंगे इंटर्नशिप के बाद में, और अगर आप मार्क्स को इंप्रूव करना चाहते हैं तो आपको 1 साल और वेट करना पड़ेगा। सो दैट क्लॉज हैज बीन नाउ रिमूव्ड। यस, जो 2 years का गैप वाला क्लॉज था दैट हैज बीन रिमूव्ड। ओके, सो बहुत सारे बच्चे पूछ रहे हैं कि एफएमजी का क्या होगा। तो बेटा एफएमजी एग्जाम, जुलाई वाला एग्जाम विल बी द लास्ट एग्जाम। नवंबर से आपका जो एग्जाम होगा अब दैट विल बी कंसिडर्ड एज द नेक्स्ट एग्जाम, राइट। सो नवंबर से अब आपका एफएमजी एग्जाम नहीं होगा। इनफैक्ट जो शेड्यूल रिलीज किया है, लेट्स गो टू द शेड्यूल एज वेल। सो एक बार शेड्यूल को देखते हैं, टाइमिंग इसको, राइट। नेक्स्ट स्टेप 2 पे बाद में आएंगे, उससे पहले जो है हम अपना शेड्यूल देते हैं नेक्स्ट 1 का। सो ये नेक्स्ट 1 का शेड्यूल आया है और इस शेड्यूल में काफ़ी चेंजेस हैं। यस, सो दिस शेड्यूल हैज़ बीन मेजरली चेंज्ड। ओके, तो ये शेड्यूल क्या बता रहा है कि नेक्स्ट स्टेप 1 एग्जाम होगा आपका मई में एंड नवंबर में, राइट। सो हमें पता है क्लासिकली मई एंड नवंबर यूज्ड टू बी द टाइमिंग्स फॉर INI CET एग्जाम, राइट। और यहाँ पे क्लियरली बोला कि अब मई एंड नवंबर में होगा। इसका रिजल्ट फर्स्ट वीक ऑफ जून में और फर्स्ट वीक ऑफ दिसंबर में आ जाएगा। उसके बाद स्टेप 2 का एग्जाम जो है वो फर्स्ट वीक ऑफ जून में होगा या फर्स्ट वीक ऑफ दिसंबर में होगा और थर्ड वीक ऑफ जून या थर्ड वीक ऑफ दिसंबर तक आ जाएगा, सो दैट स्टूडेंट्स कैन ज्वाइन द बैचेस इन जनवरी एज वेल। तो जनवरी में कौन से बैचेस स्टार्ट होते हैं? एम्स के, PGI चंडीगढ़ के, जिपमर के। तो इसका मतलब दिस एग्जाम इन ऑल प्रोबेबिलिटी is going to replace all the 3 exams, NEET PG, INI CET and FMG। ठीक है बेटा, तीनों ही एग्जाम अब आपके रिप्लेस हो रहे हैं, राइट। यस यस, जो 2019 से पहले के बैचेस हैं, जिन्होंने जैसे 2018, 2017, दैट मीन्स पीपल हु आर इंटर्न्स और पीपल हु आर पोस्ट इंटर्न्स, उनके लिए इंटरिम ईयर यानी कि दिस ईयर एक नीट पीजी एग्जाम होगा। ओके, सो नीट पीजी एग्जाम 2024 has also been confirmed by the NMC chairperson Dr. Suresh for 1 year. Okay, and these students they will be given equivalence. So equivalence का मतलब क्या है? He is also recommended कि ऐसा हो सकता है कि आप 2024 का एग्जाम दें, लेकिन आप 2024 के एग्जाम के लिए you are not that confident. So along with the NEET PG exam, you should also give the next exam, क्योंकि next exam से आपको 25 की NEET PG आपको PG सीट मिलेगी, right? So you can give the NEET PG exam of 2024 and you can also give the next exam for 25. So something like that he indicated, and he said कि he is not talking much details about that for the interns and post interns. He was more focused on the final year students, and he said the exact guidelines for that, for the equivalence and other things, and for the interns and post interns, that will be out very very soon in the gazette notification, right? तो ये बहुत जल्दी आने वाला है। और क्या important है, और क्या important हुआ? बहुत important, very very important announcement that was made was that there is going to be a mock test on 28th of July. Okay, from 28th of July, on 28th of July there will be a mock test for the next exam, and all the final year MBBS students are eligible to apply for it. The registrations for that will open on 28th of June, that is tomorrow itself. ठीक है, सो कल से ही इसका जो है वो स्टार्ट हो रहा है। ओके, एवरेज मार्किंग और नेगेटिव मार्किंग में देयर वाज नो टॉक टुडे, सो दैट मीन्स वी कैन अंडरस्टैंड there will be a +4 and -1 negative marking as was indicated in the NMC draft regulations, right? Number of attempts. So somebody is asking number of attempts. So number of attempts have not been defined, but we know now there is a 10-year rule between joining and passing both next one and next two exam. So 10 years का वो rule रहेगा. Within those 10 years you have to clear the exam, right? Okay, now which November 23? Of course November 23 beta. So that is where the exam is going to start. That means we have around 5 to 6 months time. Yes, I understand. For the first time I am still hoping, okay, that maybe this exam may not happen in November this time. It may happen in December or January, but it is very well possible AIMS Delhi is going to conduct the exam, and AIMS Delhi is reputed to stick to its timeline. AIMS Delhi people are very, very strictly, they follow their timelines, they don't delay these things, and the INICT, which is slated to be in November 23, maybe that is also replaced, and we have the next exam in November 23 itself. Anyways, for 2018 other people, they are giving the NEET PG in 24 for 1 year. So those who are in the NEET, those who are going to give the NEET 24, they don't need to worry about that. Okay, so application form for the mock test will start from tomorrow. That is going to be 28th of June. It will happen in 28th of July, right? So you don't have to worry about that. Let us go back. Let us go back and talk about the next two exam also. So next two exam will be conducted 1 year after your internship. It is, as we said earlier, an exam which will be mostly a university-based exam, and it will evaluate your competency for clinical diagnosis, for patient examination, decision making, practicals and other things, right? And he also said that some dummies or some other things will also be used. Okay, mock labs and all will be used. Actual cases can be used. There can be OSCE examinations also. Some simulations may also be used for doing this. So that will be decided by the university or the colleges themselves, right? That will only be a pass or a fail exam. The next two exam is going to be only a pass or a fail exam, right? Okay, next. We can also, see that the subjects which will be asked in the next step 2 exam will again be medicine and allied subjects, surgery and allied subjects, obstetrics and gynecology, pediatrics, ENT, otolaryngology, ophthalmology, orthopedics, and physical medicine and rehabilitation. So mostly the main subjects which are being asked in the step 1 will also be asked, their clinical vignettes, their clinical case scenarios, their patients, history taking and all will be asked in the step 2 also, right? Okay, so that was another important thing. The schedule will be decided by the NMC, right? And the respective universities and institutions will process this paper, will give the result before the starting of the PG next year. Okay, so this schedule, this is the main takeaway from today's talk. That is, the internship has to start from 1st of January or 1st of July. So that means after both the steps, both the step 1 in November or in May, you will get the chance to start your internship from 1st of January or 1st of July, right? Okay, so that is going to be there both the times, and then we'll have the step 2 exam, that will be the post internship exam, so that you can pass immediately after internship. If you are not able to pass, you can give the 6 months later, that for you will be known as the supplementary exam, right? So this was the important takeaway, very, very important. This calendar has changed in today's meeting from what was given in the final draft, right? Okay. Important announcement was the one that I have already talked about, the mock test. Also, the exam is now going to be conducted by the AIMS Delhi body. So you can expect INICT pattern of questions, clinical questions, all those, and definitely that has been stressed upon by the chairman sir, that these questions will be asked in the exam, right? Now, all the details are definitely going to come out in the Gazette notification in next few days, right? So you don't have to worry about that. Now, yes, Ayushi, I'm going to take all the questions now. If you are not able to pass the step 1, of course your internship will be delayed by 6 months. So there is no doubt about that. Okay, so what about the average score of 3 attempts? So there was no talk about the average scores. I think that since they have given away the 2-year clause, they should also give away the average score of 3 attempts. So we don't know about that. That will come out in the gazette notification only. We'll have to wait for that. But the next exam is there. We all know the first attempt should be your best attempt. Right? Okay. सर थर्ड ईयर 2020 ईयर स्टूडेंट्स को ENT और ऑफ्थल्मोलॉजी का एग्जाम देना है कि नहीं? So if it is there in the university, you will have to give the exam, but in the next you will have the option whether you want to give it immediately with the remaining 4 subjects or you give it separately. My advice is that you give, since you have given the third prof part 1 exam, you are already prepared with ENT and ophtha. It's a good time to prepare ENT and ophtha. Give the university exam, and that will also prepare you for the next exam. So ENT ophtha should be a cakewalk because you have given the exam already once, right? Is there any timeline for FMG? So you see 10 years guideline has been issued for the Indian medical graduates for entering and passing the next step 1 and step 2 exams. All right, so same thing will also apply for the FMG students as well, right? Probable date of NEET PG 2024. So I think traditionally the date has been in January, other than when it was delayed for last 2-3 years because of COVID. So you can expect the probable date of NEET PG 2024 will also be in January, right? Okay, PSM will be a part of all the subjects as it was given in the draft also, right? Dr. Akriti, will INICT November 2023 happen? Seems unlikely now. I was earlier hopeful that they will conduct at least the 2023 INICT, but after today's timeline for the next exam and the announcement of the next exam in the month of November and May, so that clearly points out that they are going to replace the INICET exam as well, right? So it is probably possible that they are going to have the next exam in the November, and that is straight away going to replace the INICET exam. Okay, any other question? So Dr. Shraddha, 2-year clause has been removed, so you don't have to wait for 2 years, right, to improve the marks in the next time. Best score will be taken or the average marks. So they have removed once again I am saying it, they have removed the 2-year clause. I am also hoping that they would have also removed the average score. But one thing that was there that you have to notice, that supposedly you have passed the 4 subjects step 1 in the starting in the month of, let's say, November. You have to pass the remaining 2 subjects, let's say ENT and ophtha, in the month of May. So within 1 year cycle, you have to pass all the 6 subjects. It cannot be that you have passed few subjects now, the remaining subjects you passed after 1 year. So that will not be considered, right? So all the questions, all the marks of 1 year will be considered in the cycle for, applying for the PG seat. So PG 25 admission will happen from the next exam, right? They will happen with the next exam. So next step 1 you have to give in 23 November or December, whenever it will happen. I'm still hoping that there might be a slight delay because it's the first time, but then it is going to be conducted by AIIMS Delhi. They are known to stick to their timelines. They're very particular about time. So let's hope that they will stick this time as well, and the paper will happen in November. Passing marks for step 1. Step 1, 50% will be the passing marks for each subject. You have to pass all the subjects for the exam. Okay. So, right, any other, I'm looking about the questions. So sir, what is the significance remaining in going to final year classes and postings now? Very, very significant. You see, questions are going to come from, clinical concepts. So you have to study. There is no doubt about it. You have to study theory. But if you go and see a patient, the same will always be imprinted in your mind. You will always remember that concept. So study, watch video, study from your lecturer, study in the college, and go to the ward postings. Then examine the patient, touch them yourself, look at those you have to palpate them, you have to do percussions, listen to the auscultations. Then only you will remember the things. So clinical postings are becoming more and more important. Okay, that is the entire idea of this exam, to make you a better doctor by giving you more clinical case scenarios. So unless you go to the clinical postings, you will not learn these things. So you have to go there, right? How much total score for next one and passing marks for next question? So 50% marks, as I said, for each of the subjects. You have to clear all the subjects to be evaluated as pass, right? If you don't clear any subject, you will have to wait for 6 months to give it again next time to pass the exam, right? So in every year there will be 2 next step 1 exams, right? Both of them are the main exams. So if next replaces INICT, how will AIMS take admission for PG this year? So you see, if you follow this timeline, the timeline is exactly the timeline what they follow for the INICT as well. The exam happens in May and November. The result comes in the first week of June or December. And, then there will be a next 2 exam that will happen next year in December, June or December. And then the result comes in 3rd week of June or December. So it is possible, just like NEET PG, they might have the INICT this year as well for November and May, and then from next year it is implemented. So all of that is going to be clear in the next regulations, the gazette notification which is going to come up. But yes, the NEET PG 2024 exam is going to be there, so we can expect that the INICT may also happen, but the next is definitely in, right? So interim year, 1 year, as I said, there will be an equivalence. So the marks scored in the NEET PG, so there will be an equivalence between the NEET PG and the next exam. Dr. Sharma in fact stressed that interns and post-interns who are giving the NEET PG exam, because they have already cleared the final prof, they can also give the next step 1 exam. They're going to equalize the marks. How they are going to do that, what will be the criteria, all that was not told, and all that was told to us was that you'll have to wait for notification and exact guidelines will come in that, right? No, will it be compulsory to attempt the November 23 exam? No, it will not be compulsory. Nobody can force you to do something. You can always wait for 6 months and give it 6 months later as well. But I believe that you should give the exam. You should prepare. If you are prepared, you should give the exam in the November. So prof exam for 19 batch. So basically this exam is going to replace your prof exam of final year part 2. So you don't have to give the final prof exam. This will be the final prof exam. Next exam will start from 2024 May. So that's a wishful thinking, right? We don't know when the next exam, but he said the next exam is going to happen. Dr. Sharma used the timeline of, between December, January or February, somewhere like that, the exam may happen. The timelines given in the exam, that once they come in the full routine, they will be in the month of May and November, the next step 1 exam, right? December FMG is unlikely to happen now, because that is being replaced by the next or the exit part of this exam. So that is not going to happen. Yes, so people who have passed 6-7 years and doing job as medical officers. So as I said, post interns, they will have 1 year of the NEET PG exam as an interim measure, and later on everyone will be giving the next step 1 exam. So something like that has been quoted already over there, right? Prof 2, what to do? Prepare for, Path, Pharma, Micro, right? Give those papers, prepare for those subjects. Those are going to be your foundation subjects, and they are going to be a part of the next exam as well. So you prepare those foundation subjects, prepare them nicely. High time, you should also revise anatomy, physiology, biochemistry. You have some time over there, clear all your concepts, so that by the third year, you can actually start preparing your clinical subjects nicely, right? Marking for subject questions, marking will be +4 and -1 as it was given in the draft notification. There has been no change announced today, so we assume the same will be continued, okay? So next November 2023 में होगा क्या? See, they are conducting a mock in July. Nobody believed that. July 2023, 28th July, we are going to have the mock exam. You can register yourself from tomorrow, 28th June. So guys, if you still want to close your eyes and say that the exam will happen next year, you can't believe it, then nobody can help you. Exam is here. Okay, get out of the sleepy mode. Still thinking exam November 23 में नहीं होगा, 24 नवंबर में होगा. Guys, which world are you living in? Next month में mock test है. अगर इस जुलाई में NMC can conduct the mock test, तो नवंबर में definitely they can conduct the main test. Get out of that sleep. Okay, I don't know what else do you need to get out of the sleep. Who is feeding you with what kind of news? NMC chairperson Dr. Suresh himself came online to tell these things. So get out of that sleep कि अभी नहीं होगा, अभी नहीं होगा. Okay? अब हो गया है, आज अनाउंस हो गया है, नेक्स्ट मंथ मॉक टेस्ट है, नवंबर में डेफिनेटली एग्जाम हो जाएगा. ओके राइट. सो अभी भी आपको लग रहा है तो आई नोबडी कैन हेल्प यू नाउ, बिकॉज नाउ गैजेट आने वाला है, फॉर्म्स आ जाएंगे, फॉर्म्स भी फिल हो जाएंगे, इवन देन यू विल कीप ऑन आस्किंग दिस क्वेश्चन. सो ये गलत है. Okay, be prepared. Acceptance is the one of the first parts that you have to understand. Third prof, जैसा हो रहा है वैसा ही होता रहेगा. I think within a few years, ENT and ophthalmology anyway is going to be shifted in the second part of the third prof. So that problem कि कुछ लोग ENT ophthalmology पहले दे चुके हैं, that problem will be sorted out because the schedule, MBBS schedule has been changed. For that time, I think you will have the option of giving ENT and ophthalmology initially in the step 1, or you can give it 6 months later as has been announced. Percentage or percentile? I don't think it will be a percentile. I think it will be a percentage because that is what is mentioned everywhere. Today also it was talked about percentage. There was no percentile paper. Percentile paper means 50% percentile paper means 50% students will fail. That cannot happen. This is also an exit exam. Okay. 50 percentile passing marks means 50% students have to fail. Only 50% will pass. That cannot happen. Okay. So it will be 50% passing exam. Right? Okay. So NEET PG 2024 is the last NEET PG exam. Yes, that is most likely to be the last NEET PG exam. That is also an interim measure the government, the NMC has taken so as to help the people who are in internship or who have completed their internship. Okay, improvement will be allowed. Improvement will be allowed. You can give the improvement. The 2-year clause has been removed, right? That has been removed already. So you don't have to wait for 2 years to give the improvement. Now, score kaise lenge, whether that will be an average score or the best score. So that's something we will come to know in the final draft notification. Sir, what about 2020 exam? You have 1 year. Your seniors will be giving the exam. So everything will be clear to you. So you don't have to worry about it. Okay, English videos available in Allen Next. So Allen Next app already has all the questions and everything which have been drafted for your next exam. So we have been knowing and speaking. I especially personally have been speaking about this topic कि 2023 में next exam आ रहा है. So Allen Next app में we have all the questions that you can attempt. So those questions, whether those are race questions or we are also have the next QB. So all the questions are now being uploaded in the next QB. So they are based upon the pattern that you can actually get in your next exam. So that I think is the only app over there which will have all these kind of question. It is actually the Next Ready app that is there. So what about FMG 2017 to 23 batch? Will they give next? Yes, of course, they will have to give the next only. Okay, so July 2023, 30th July FMG exam, that's going to be the last FMG exam. There's not going to be any more FMG exam, right? So December, you have to accept it is going to be a next exam. So if we give exam in November and we fail in it, then our first chance will be lost. It's like you have 10 years chance. There is no number 1, number 2 chance. Whenever you clear the exam, you clear it. So you give the November, then you have to go for the May exam. Okay, strategy to prepare for this exam. So 6 subjects: medicine, surgery, obs and gynae, pediatrics, ENT and ophtha. These 6 subjects are going to have the maximum weightage now, right? So I always believe that you cannot solve medicine surgery without knowing your basics like anatomy or physiology or path or pharma, but those questions will be 10 to 20%, 10% direct, another 20% will be indirect, implied, integrated questions. But you'll have to give due diligence to these 6 subjects. Earlier NEET PG was a combination of 19 subjects and 300 questions. So even if you have, let's say, left ENT or you have left ophtha and you are done with all the 17 remaining subjects, you can still score a under 500 rank. Not even 1000, you can even go to under 100 rank because you have done with all the remaining 17 subjects. Here, this will not be possible. The 6 subjects have to be given due importance. All of them have to be passed. 50% marks have to be gained in all these 6 subjects. So you cannot leave medicine, you cannot leave pediatrics, you cannot leave ENT, ophtha, obs, gynae or surgery. Okay, so these 6 subjects weightage definitely changes with the coming of this exam, right? Okay. So how to prepare for NEET PG 2024 using LNX. So I'll have another session for that. We'll be talking about that in detail. I'll come and talk to you about strategy, how to prepare, how to utilize the remaining time in the best possible way, right? Okay. So that is going to be there. Can post-interns give next one? Yes. Yes. Post-interns and interns, rather they were motivated. They were asked, they were requested by the chairperson that you should also give the next one exam. There is where he said there will be an equivalence created between the next step 1 and the NEET PG exam for the interim time when we are going to conduct the NEET PG exam, right? Okay, will there be negative marking? Yes, as I said, in the draft regulation, it was +4 and -1 for every question. So the same will be continued. सर अगर साल को 2 टाइम्स एग्जाम कंडक्ट किया जाएगा तो फिर क्या हर साल सेंट्रल इंस्टीट्यूट को छोड़कर बाकी सब इंस्टीट्यूट पर भी साल में 2 बार पीजी एडमिशन होगा? अनलाइकली okay, central institutes will only have the PG admissions. So the 2 times next step 1 will be conducted and the entire cycle will be used, cycle of the marks will be used for giving the PG seat next year, right? Okay, forensic medicine and PSM are important because they are going to be a part. 10% of the questions in every subject is said to be from FMT and PSM, community medicine. So they are again going to be very important subjects over here. In fact, every subject is going to be asked. You can't say that anatomy nahi aayega, anatomy bhi aayega, biochemistry bhi aayega, applied subjects bhi aayenge, short subjects. Applied subjects means dermatology, orthopedics, anesthesia, psychiatry, radio, they also will be there. Okay, right? So subjects to sare honge, only thing that the weightage is going to change now. Okay, can we give some subjects after 6 months? So people who have cleared ENT and ophtha in part 1, final year part 1, they can choose to give these 2 subjects after 6 months. right? That will be the option given for, next 1 or 2 years, 2-3 years till the time ENT and AFTA are being shifted to part 2 paper only, right? So that's also an interim measure taken, right? Okay, so I think I have covered all the questions. FMG is a 6-year rule, so it doesn't matter. I think the 10-year rule will imply if you're going to some country where it's going to be 6 years MBBS instead of 5 years. So I don't think that the government is going to give relaxation in that. Less focus on PYQs. So you see, PYQs, when you ask me PYQs, previous year question, recall questions, they always come as 10%. What we always stress is the PYTs. PYT, previous year topics. So topics are those high yield topics or previous topics because those are more clinically relevant. So they always give questions, right? So you should always focus on the previous year topics because that is the best way to find out the high yield topics, clinically relevant topics, which the clinicians deal with each and every day. So as it was said, 60 to 70% topics or 60 to 70% questions will be from topics which are must to know, high yield topics, right? So those you can also call as previous year topics because those are must to know topics. So if you know them, 60 to 70% question is easy. Okay. Sir, can third year now will give exam in November 2024? Yes, third years will give the exam next year. That is there. Okay. So I think I have solved 20 years MBBS pass nahi hua, uska kya hoga? I think the 10-year rules, as soon as it kicks in, the students who have not passed for 10 years, more than 10 years, they will not be allowed for the exam, right? So when will 2019 batch? So all this announcement was for the 2019 batch today only. So they're going to get the next exam. For this year, because of some delays that happened in the schedule of your teaching post-COVID, it is likely that the exam may not happen in November, but may happen in January or February. That is the maximum delay you can expect. And at the same time, you will also have the NEET PG 2024 exam. So that is for interns and post-interns, that is going to be there. So that is the only delay that we are looking at for this timeline. But let's remember that there is going to be a mock paper on July 18th, 2023. And immediately we'll also have the notification also. So we'll get to know all the remaining details. December 23 FMG exam will not happen, beta. Right? So that I have already told you. Right? Internal exam is cancelled. No, see, this is going to replace the internal exam, and attendance therefore is compulsory because the college will allow you to give the exam only when you have done the college attendance. All right. So you have to go and listen to the lectures. You have to go and attend the clinical postings, and the questions will be clinical questions. Right. So I think I have discussed all the questions. I'll be again coming up with another session for you where I'll be, discussing the strategy and how to utilize the time maximum. But today's live webinar has put end to one doubt that everyone was having, ki next hoga ki nahi hoga. So next is here, students. It is happening. So let's start preparing according to it. Okay. There is no room for any rumors now. Okay. That is there. Now they're going to be the next exam, and step 1 is going to happen twice a year. Right. So that is also clarified now. So I hope all of you will you'll utilize all this information, and you'll prepare your strategy and you will give your best. So best of luck, guys. Don't worry, we all are here to help you in each and every moment of your preparation. So don't worry about this. We'll again come to you with the strategy, how to utilize the time and how to get yourself out of this panic mode. So keep studying and see you very soon.